Well, every year, hospitals provide vital health care services to millions of people. Managing all those patients can be a complex task. However, operations management techniques used by businesses could also help hospitals manage patient care. Joining us now to explain is Kenneth K. Boyer, professor of operations management at the Ohio State University Fisher College of Business. Kenneth, we appreciate your time. We just heard from two doctors who are now CEOs. That's got to be tough. To rearrange their thinking and run a business. Managing a hospital is very complex. Do you agree?
Absolutely. What has really happened in the last 50 to 60 years in healthcare is there's been tremendous medical and scientific progress, but I like to characterize it as we've gone from the country doctor with the black bag to a wonderfully complex system. And what I'd like to help bring to healthcare is a little bit more systematization. Where people talk to each other to exchange thoughts and the handoffs work a bit smoother.
The guy with the black bag used to do everything. Now you're going to 12 different doctors, right?
Absolutely. There's literally right-hand surgeons and left-hand surgeons.
What does your research show?
My research shows some evidence based on a survey of 271 quality directors at hospitals nationwide that some basic operations management techniques such as improving the culture, having people discussing patient safety more, standardizing some things, value stream mapping and understanding how the pieces of the puzzle fit together, and looking at the whole system as kind of a medical supply chain really can contribute to better patient safety and improved outcomes.
As far as you can tell through all of your research, are hospitals doing this, or are they not doing this, or are they doing it to some degree?
They are doing it to some degree. There are major efforts out there. I've been very influenced by the research of a Peter Pronovost from Johns Hopkins University, who did research on central lines, which is a line you get when you go in to have surgery. He reduced the infection rate at Johns Hopkins from 11% to 0%. In a study in Michigan, saved 2,000 lives and $200 million. Recently, just last week, the Ohio Hospital Association announced that they're doing the central line checklist in Ohio, and they've reduced the rate of infections by 50%.
Your contention is that healthcare right now is very much like a supply chain. Is that a good thing, or at times not a good thing?
It's absolutely both. It's a good thing in that we get specialists who are incredibly well-trained in their area, but it's a bad thing and those specialists have to hand off to numerous people. And anytime there's a handoff, as we can see in football, sometimes the ball gets dropped.
At times, too much communication, too many levels of communication, too much from here to there, and a patient being put here and there, right?
Absolutely. And so there are a couple things that are really looking promising for ways of improving the situation. One is the use of IT. But it's not just the IT, it's analyzing the data and getting people changing their culture to use it. Second one is getting into healthcare and teaching that culture is incredibly important, that everybody's members of a team, and that there have to be smooth handoffs. And the third thing is just to really remember that medicine really is a supply chain. There are a lot of pieces. Every piece of the puzzle needs to be there.
These operation management techniques, they're used by many businesses, normal businesses. I would say a hospital is sort of an abnormal business because it is so complex. Can hospitals implement these techniques?
Absolutely. It can be something as simple as, in Peter Pronovost's book, they give an example of central lines need to be changed after 3 days, I think. And they studied one floor of a hospital and found that the way that the lines were being monitored is they put a date on it, and they expected the nurses to take the date, add 3 days, and know when to change the line. Seems like a simple thing, except healthcare is very stressful, and people are very busy. It's easy to overlook that. So they went in and they color-coded the lines, red, blue, and green, and put up a chart and said, on Tuesdays we remove all the red lines, Wednesdays we remove all the blue lines, Thursdays we remove all the green lines. Problem solved.
Final question for you. What do you hope to gain from your research? It sounds very common sense approach to running a business. What do you hope to gain from it?
I hope to gain some insights into how basic business and operations techniques can help healthcare, but I hope to also propagate that by perhaps setting up at Fisher College an education program to bring healthcare people in and help teach them these techniques.
Kenneth, we appreciate your time today. Interesting stuff.
Thank you very much.